Today, I am going to show the young lady the best method of personal oral hygiene. I want to explain to her exactly how to accomplish the best method in her own mouth. Also, I want to explain to her why it is so necessary to use the best method for the prevention of dental disease. What has already been done, I have given this young lady a stain peel. It has dissolved completely in her mouth as she has taken her tongue and pushed this stain peel around, allowing it to touch every tooth while it's been dissolving. The reason for this is this stain peel contains a special dye material which has the ability to get in and stain only the unclean areas of her teeth. We will now show her exactly where these areas are. Now, Julie, I want you to close a little bit. That's it. Now then, if you will look, you will notice that these lower front teeth are stained quite a bit. You will notice in this area there is quite a bit of plaque material. Now, what Julie needs to understand, that this red material that is on her teeth is exactly what causes practically all of her dental problems. This is a soft, sticky mass of material. Once it gets on a tooth and just sticks to that tooth long enough, it will finally eat a hole in that tooth, causing a cavity. When this very same material gets down between the gum and the tooth, just like right in this area here, and if it stays there long enough, it will finally irritate those gums and get them started bleeding. Now, the way to prevent both decay and pyorrhea in a mouth, all you have to do is just get all of this material off of the teeth. Now, this is not the easiest thing in the world to accomplish, and I'm sure this young lady would testify to that, because had it been real easy to do, I'm sure we would not see this material on her teeth today. Now, in order to accomplish this, first of all, a very special kind of toothbrush is necessary. This toothbrush is designed in order to especially go in between the gums and the teeth and clean all of the plaque material, or this red material that you have just seen, out of the crevice area around the tooth. Also, one other item which is extremely important in the best method of personal oral hygiene is to use dental floss and use it correctly. Now, what I'm going to do now, I am going to show Julie exactly how to get every bit of the material off of these teeth with just simply using a toothbrush and dental floss. Julie needs to understand, though, that practically everything I'm going to show her today is going to be something entirely different than what she has been doing before, because had she been practicing this method, we would not see this red material on her teeth. And I certainly want Julie to pay close attention to me, because practically everything I'm going to show her about using a toothbrush or dental floss is something entirely what she has been doing previously. The first thing that I want Julie to do once a day, open real wide, is to come in and hold the bristles of this brush at about a 45-degree angle to where the gum joins the teeth, with a very definite and firm stabbing motion. I want her to stab the bristles right into this area, exactly as I'm doing, vibrate them and sweeping up. I often tell my patients this is very similar to taking a broom when you're cleaning the corner and just merely stab in, push a little bit, or vibrate and come up. Now let's take a close look at these lower front teeth and see what happens when I use this method correctly. Okay. You see, the red is gradually disappearing. Although this is not, yes it is too. If Julie will notice, around that cuspid there, her gum is beginning to bleed just a little. This is something that will definitely happen in the Bass method of personal oral hygiene. When you start this procedure, the gums will tend to bleed a little bit. They will also get just a little sore. However, if Julie will merely follow all of my instructions that I'm going to give her today, once a day, she will notice that on about the 6th or the 7th day of using this method, her gums will no longer be bleeding. They will not be sore. Now, as you notice, now I haven't gotten it off. Now open real wide, Julie. Real good. Around these teeth. Okay. Now I instruct the patients, of course, to do it around the outside surface of each and every tooth. Now let's get these uppers here. I inform my patients to watch closely all the time to get an idea how long it takes to get this off. Just generally the first stab won't do it. Now practically all of that is gone. Now after we have shown her how to clean the outside surfaces, the next procedure, now open real wide again, is to go in, but this time now we hold the bristles at a 90-degree angle. We once again come in with that stabbing motion and we merely vibrate them or stab them in that area. The reason for this is to clean the outside surface of the teeth. One thing you need to warn a patient about in this area is to never, and I repeat, never take any short back and forth strokes like that. If you do, you will abrade the teeth. Now, after they are instructed, or after Julie is instructed in cleaning the outsides, I then want her to clean the inside of all of her teeth by the very same procedure. Now, to complete the use of the toothbrush correctly, I now want Julie to place the bristles of this brush on the top surfaces of her back teeth. And once again, with a digging action, I want her to clean the top surfaces good. However, now Julie has two choices here. She can either stab them in exactly like this, like she did on the sides, and clean very effectively. However, she can also, in this area, use short back and forth strokes, because no matter how much of this you do on the occlusal surface, with this toothbrush, it's impossible to wear any ridges in those areas. Now, that completes the Bass method for using the toothbrush. However, we now come to the most important and probably the most neglected feature of oral hygiene, and that is proper use of the dental floss. Now, if you will just think a minute after examining Julie's mouth, you will realize that there is a number of areas that have not been cleaned yet. Now, I'm going to clean the remaining unclean areas of her teeth with the dental floss. I certainly have the patient hold the mirror good and watch me real closely as I do this, because in most cases I can surprise them with what this floss really does. Now, the first thing, open real wide, is to remember that even though you have brushed the back side of the last tooth real good, that it's still not perfectly clean, so that area needs to be flossed. I want the patient at this stage to merely get the feel of it. I'm going to show her in greater detail later on about the use of the floss. I have pushed this under the gum as far as I can go. I'm holding it taut against the tooth, and I'm just coming up. Now, if you will notice, there is some red material on that floss right now. Now, of course, this indicates plaque material. All that plaque material has to do is stay there long enough, and it will finally irritate her gums and get them started bleeding. And see, there is simply no way to remove this material except with the dental floss. Now, then, I merely want the patients to get the feel of this. I explain to them that there is simply no way for them to reach the in-between surfaces of their teeth except with the dental floss. You see more red material indicating more plaque. Of course, you clean the mesial by a scraping action. Actually, by holding this floss taut, these individual filaments have spread out and they're trapping all material between there. And then, one thing you should do after each use, you'll notice I have this wound around my finger. Then you should wind it once to have a clean area when you come to the next area to clean, and then I'm going to clean the distal of this last one. Now, Julie right now has more or less gotten the feel of exactly what I want her to do here. Now then, what I want to do is show her something that is very important with the floss. I'm going to push her lip out of the way. Now, I want you to keep your eye on the floss. I want you to notice what is going to happen to this. Can you see how far under the gum that will go? See, I am not hurting the patient, and you must go to this depth, or at the very bottom of the tooth where it is attached to the bone, and clean that area real good. If you will just stop and reflect just a moment or two, you will realize that a toothbrush will not clean that area. After I get through showing the patient exactly how to accomplish this method, I explain to them some other very important facts. I want them, or I want all my patients, to clean their teeth by this once a day, and preferably once a day only. I tell them to pick a time that's convenient for them, where they can spend plenty of time, do this thoroughly and correctly, and if they will do that, they really only need to do it once a day. I do add, though, that if it is convenient for them, it is best to do this at night, right before they go to bed, and then to not put any food in their mouth until they eat their first meal the next day. That concludes my demonstration of the Bass method on the first patient today. Patient, the Bass method of personal oral hygiene, I want to discuss the toothbrush and the dental floss because these are most necessary items for the Bass method. If you'll take a close look at this toothbrush, the length of it, the width of it needs some very specific specifications. But most importantly, the bristles of this toothbrush are especially designed to thoroughly clean these teeth. If you were to take one of these bristles out of this toothbrush and place it under a microscope, you would find that it is made out of high-quality nylon, meeting some very definite specifications as far as length and width. And most importantly, you would notice also, by viewing this under a microscope, that the head of each one of these bristles is perfectly rounded. It is designed this way in order to penetrate the gingival crevice area and not injure the gum in any way when used properly. The floss is the next very important item. There are many things you're probably not aware of when you see this special kind of floss. I can assure you it contains a very definite number of filaments. These filaments meet some very specific qualifications as far as diameter goes. Very importantly, this floss is unwaxed. Why floss is waxed today is really hard to understand, when only logic will tell us to not have the paraffin interfering with the cleaning of the teeth, because it is necessary for this floss to flatten out and trap all of the plaque material between the individual scrapers. Now, this second patient that I am going to teach the Bass method to today may present a few different problems than the other patient. And we will, of course, we all know that each patient is an individual. Each mouth is highly individualistic. However, the exact method as laid down by Dr. Bass can clean any mouth regardless of the shape of teeth or the type of appliance that is worn in the patient's mouth. Now, first, we're going to start with the toothbrush once again. I'm going to start in the first of all, though, let's look at her mouth and just look at the unclean areas. Once again, she has used the stain peel. Jane, if you will, close your mouth a minute. Now, I'll raise this lip up. Now, let's just look right here. Now, you will notice these red areas on these teeth. Once again, as I explained when I was showing you the stained areas on the first patient, all this material has to do is just stay there long enough. If it does that, it will finally eat a hole in the tooth, causing a cavity. Now, Jane, I want you to open real wide. Now, for instance, let me have her. Now, you see, this lady has some crayons. She has some fillings. You see those right there? Now, the exact reason those teeth had to be filled was due to the fact that at one time, this red material, which you see up on this tooth, just merely stuck there long enough to just literally eat a hole in that tooth, causing a cavity, which resulted in the fact the tooth had to be filled. You see, she had so much damage to some of these these two molars here, that it required actually placing crayons on these. Now then, I want Jane to understand that even though she has all of this dental work in her mouth, and even though she has many crayons and fillings, that with proper care and using the Bass technique expertly, she can keep what teeth she now has for as long as she lives. Now, I'm going to show Jane exactly how to do this, just like I did the first patient. Once again, I will want her to come in, hold the bristles of this brush at a 45-degree angle, and with a very definite and firm stabbing motion, I want her to stab the bristles into that area. I want her to vibrate real good, and I want her to sweep up. She will be using, once she starts this, she will be using a digging action there to dig all of that material from between the gum and the tooth. If the entire population of the United States could understand and do this real good once a day, it would be the most unique nation in the world, in that caries and parodontoclasia would become a disease of the past. and we would only read about it in history books. Once again now, we see that there's some bleeding here. I really don't know whether it shows in her mouth, but look on the toothbrush there. This is very evident. In most cases, when you show a person who is not now using the Bass method, in practically 100% of the cases, you can demonstrate bleeding of the gums. Now, once again, we want to close just a little. We want Jane to clean the outside surfaces of every one of her teeth real good, just like this. Now, you see the red stuff on those teeth. Now, let's like this. Stab in, vibrate. I want Jane to get an idea how long it's taken me to get this red stuff off her teeth. Now that is just about all that I can get off with the toothbrush at this stage. Have no fear, when she leaves this chair, every bit of this plaque material will be off of her teeth, because that's exactly what the Bass method of personal oral hygiene will accomplish. Actually, I do have practically all of it off now. After she has completed this part of the oral hygiene, then I want her to come in. I want her to hold this toothbrush up where the ends of these bristles can reach the back side of that last tooth. And then I want her to stab this in a few times and clean that area good in this manner. That's step number 2. Step number 3 is to then come over to the lingual side and follow the exact procedure that you did on the labial or buccal side of the teeth, or perhaps I should say labial and buccal. Now then, when she gets to the lower front teeth, a special problem may come up there, especially with crowded teeth. And in case, it is much better to hold the toothbrush in this manner and to come down around the teeth and force these bristles in between the gum and the tooth in this manner. Of course, naturally, the upper, the same thing, outside, inside. Of course, once again, it's a good idea to hold the brush like this. However, now this is just strictly a personal choice. I believe in her case, she could reach them exactly like this, just whichever method she wants to use here. The main thing is to get these bristles between the gum and the tooth. Now then, the next procedure, I want her to understand at this stage that she has gotten her teeth as clean as possible in those areas that can be reached with a brush, only in the gingival crevice area. Now, we have not cleaned some of the surfaces of the teeth yet. We're going to do that now. Now, we're going to clean the outside surfaces, though, in this manner. We're going to come in and we're going to hold these bristles at a 90-degree angle with a very definite and firm stabbing motion, and vibrating them a little bit out of her to just dig all of this material outside surface of the teeth. Once again, I emphasize to Jane, as I did to Julie, to not use any back and forth strokes in this area in order to prevent any abrasion of the teeth. If she will do this, they will be cleaned adequately and they will not be abraded. Now, after she comes that step to the outside, then I merely want her to do the same thing on the inside, or I suppose what a professional person would want to say, the lingual surfaces of the teeth. On around. Now, the reason this is so important, of course, we still got one more area to get with a toothbrush, but the reason this is so important, you've got to just stop and reflect a moment and know that each and every surface of a tooth can decay, and each and every surface of a tooth must be cleaned. And this is exactly what using the Bass method very specifically is all about. Now then, after she has cleaned several surfaces of her teeth. Now then comes the top surface. Now I'm going to tell Jane, as I told Julie, a good way to do this, once again, is just stab in and vibrate like she did the other time. But it is also permissible, if she wants to use short back and forth strokes. Because like I say, in this manner, and using this proper brush, it is impossible to wear any ridges in the top surfaces of her teeth. Now, if a person will just stop and analyze the areas in the mouth where dental disease can occur, 47% of the areas in the mouth and around the teeth cannot be reached with the toothbrush, only with the floss. Any method that does not call for the use of dental floss is totally inadequate. If any person just lives long enough, and if they are not using dental floss, they will eventually lose their teeth. Now, what I'm going to do, since this is so important, and since I made that statement, I want Jane to be very thorough and specific in the use of the dental floss, and I will now show her how to accomplish this in the very same manner that I showed Julie. I want her to understand that in spite of the fact that she has brushed around the back side of this last tooth, that she still hasn't got that thoroughly and completely clean. Now, in order to do that, she needs to push this floss to the very bottom of the gingival crevice area, holding it tautly with the tooth, against the tooth, just caught with it. Now, we've cleaned that one area. Now, I want her to understand, though, that these in-between surfaces, there is simply no way possible to reach them with a toothbrush. The only possible way we have today is with the dental floss. Now, I have got some plaque material here. I don't know whether it will be real obvious or not, but there is some red material on this floss. Perhaps we'll get a little more out later on. Oh, yeah, no, just a minute now. Now, all I want is for Jane to just get the feeling of this right now. I'll go into more detail later. Now, if you will notice, that floss right there has got red on it. This indicates that plaque material is between her gum and tooth. If that material just stays there long enough, she will eventually have a gum disease. Now, I want to demonstrate to her, I want her to see this very closely and understand it. Jane, what I'm doing, notice how I'm holding this against the tooth. I'm pushing. Now see how far under the gum this will go? We need to take this floss to the very bottom of the gingival crevice area. I'm going to move around in the mouth here and see if I can't pick up some of the dye material. Maybe I should be there. Now you see how far under the gum that will go? See, there's simply no way to clean this area except with a floss. Now then, if you'll look real close, you'll notice all of the red material on that floss. There is simply no way to get that out except with the dental floss. My only closing remark here is one that I want everybody to understand, that I show each one of my patients this method. The reason I show each one of my patients this method is because I believe, Dr. Bass believes, his method of personal oral hygiene for the prevention of dental disease is everything. I thank you.